All right, awesome. So we are gonna formally get started here, and we are gonna talk about semaglutide, also known as Wegovy. So Wegovy is like the brand name, and semaglutide is a more of a generic form where you can get the product without it being kind of like the brand. So for the sake of introduction, my name is Sherry Stoka. I do see some new people on here. So for those of you who don't know me, I own Wellness MD and Wellness, and my background is integrative nutrition and functional medicine. So we are all about really understanding the whole body so that optimal weight loss is possible. But today we're going to be talking about a new weight loss injection or medication, I guess you could say. And to be quite honest with you, this is going to be a really fun conversation because this kind of takes me outside of my realm a little bit, but I think it's gonna excite a lot of people because our programs work super effective, but you gotta put in a lot of the work. So let's go ahead and get started here. I'm gonna start out by just helping everyone understand what Wegovy is, what again also known as semaglutide. So recently, the FDA approved this medication for chronic weight management and type 2 diabetes. I'm just going to move something here. So this is an injectable. This is administered subcutaneously once a week. So that's if anyone did HCG, that's what it is. It's not like going into the muscle. It's a very simple injection. So this is a synthetic hormone that essentially is going to increase what we refer to as glucagon-like peptide. It's called GLP-1. And this is what really is what drives satiety. This controls the appetite. It's what happens when food goes into the stomach. It hits the GLP-1 and tells the brain you are full. So this is going to really affect the appetite and suppress the appetite. It's also going to enhance an insulin response. We're going to talk more about that, but insulin is super important, especially for people who have high blood sugars, they're type 2 diabetic, because I will tell you that, when you go to the foundational root of weight issues, oftentimes it's because sugars are sitting in the blood and we cannot get them into the cell to be used for energy. So, that's kind of the root of diabetes, but many people are walking around with really high blood sugars and insulin's not working properly. So this is really going to help kind of clean up the blood sugars that are residing and inhibiting fat loss. GLP-1 is going to lower glucagon concentrations. I know that doesn't make much sense for you, but again, it has to do with blood sugar regulation. It's also going to slow gastric emptying. So oftentimes people have, when they eat, food kind of goes in, goes out very quickly, and then you're hungry again, but it is going to kind of slow it down. So it will, kind of sit there for a little bit so you get that feeling of fullness. So we know for sure, and I've been doing like massive research on this in the last like 2 to 3 weeks. And so we know the appetite is definitely suppressed. Now, okay, so the clinical uses, like I said, it is approved by the FDA for type 2 and chronic weight management. So I just wanted to add this in there. In the studies that they did, they basically demonstrated that, the all optimal, outcomes are when you add it to like a diet and exercise regimen. When you're looking at a person who has type 2 diabetes, that is such a chronic inflammatory, chronic disease state. So there are so many risk factors associated with that. So there's going to be a significant reduction of major cardiovascular events, myocardial infarction, stroke. So these are things that we consider in the medical community to reduce risk. We're not always just looking at like reducing weight. It's like looking at all the other things associated with a higher weight, but understanding that some people don't have all of those chronic, conditions. They are literally just looking to lose weight. And obviously that's going to help support other conditions as well. So it's approved for weight management. So people that have chronically, just been unable to lose weight. Again, it's advised as an adjunct to a reduced calorie diet and increased physical activity. This is their verbiage. It is approved for anyone who has, and this is more for like, insurance purposes, if you're looking to get this approved by your insurance. So this is what they look at. Do you have a BMI greater than or equal to 30 in itself? Or what's also approved is if you have a BMI greater than or equal to 27, but you have a comorbidity, a comorbid condition such as, are you being treated for hypertension, high cholesterol, etc. All right, I wanted to take a moment just to talk about type 2 diabetes, because even though many people who may be on this call are not type 2 diabetic, it's important to understand how blood sugars play a role in our ability to lose weight, because it kind of is the foundational thing. So type 2 diabetes is absolutely a chronic medical condition. And it's when sugar, so when you eat certain foods, carbohydrates, sugars, so many foods just have sugar. And what happens is sugar begins to build up in the bloodstream because insulin is not functioning properly. Because insulin, basically what happens, you eat, what you eat is broken down into sugars, whether it's pasta, rice, all carbohydrates are broken down into sugar. And that is obviously goes into the bloodstream, and then insulin comes along and basically pulls it out and takes it to the cell so the body can actually use it for energy. So with people with type 2 diabetes, the insulin doesn't work properly. But what I will say is that there are a lot of people who have this condition and do not know it. So a lot of us are having a really hard time losing weight because the sugars are still sitting in there and we're not removing it. And so that's what I'm going to really kind of talk a little bit more about. So literally our bloodstream becomes syrup when the sugar does not leave and go into the cell to be used. So this is, if you're going into your doctor and they're checking your glucose or your blood sugars and they're like, oh, it's at 99 or it's not quite, 126. I'm telling you, like anything from like 95 to anything over 100, you already have syrupy, blood. So this is what happens, if you think of our body, we have this circulatory system that goes to every part from our toes to our brain, to our fingers. And we have microcirculation, we have vessels that are very tiny, and we have large arteries. So what happens is the smaller arteries or circulatory aspects of the body start to coagulate. They start to get very thinner. So the blood, the high sugar amount starts to restrict blood flow. Okay, so again, kind of thinking not just for diabetes, but anyone who has like elevated blood sugar, it's already making its mark on your circulatory system. Initial symptoms of high blood sugars are brain fog, fatigue, you have high anxiety, you're hungry all the time, you're thirsty, and you have cravings. That's kind of like the initial symptoms. When you are headed towards more of that type 2 diabetic, these are some of the symptoms that you'll experience. You start to get blurred vision, your breath is kind of different. You start to get like this taste of acetone, a lot of GI issues, bloating, maybe you're frequently urinating, respiratory, shortness of breath. Actually, and initially for those who are entering into the state of like actually diabetes, you lose a lot of weight initially, and then obviously that rebounds. But I understand that you are all on here for weight loss, but the reason why I wanted to add this part into it is because the way that our system diagnoses prediabetes is we wait so long. And it's like we're already in the state of being a diabetic when we go into our doctors, because they're like, yeah, you're not quite there. Just continue doing what you're doing. And I'll talk a little bit more about this, but I hope I'm not losing everybody on this. So long-term complications of diabetes are significant. They're debilitating. So blindness, heart attack, peripheral neuropathy, which is basically loss of feeling, diabetic foot infections. This is why people get amputations, because of that microcirculation. No longer is that blood flow oxygenating those areas, because the sugar is actually causing it to be too thick and unable to kind of get to those areas. Kidney damage, obviously, in the cardiovascular disease. So when diagnosing, again, if you are going in and getting regular checkups, just please do me a favor and look at your blood sugars, because anything below 90 is good. Like if you're at like 99, and I know that 126 is diagnostic of diabetes, you're already there. So just kind of take a look at that if you're getting your blood test done. So insulin obviously is so part of this. We're not checking insulin levels in just our regular blood tests. And I just want people to understand that insulin levels have to be so damaged before you will see the blood sugars affected. So that's why I'm always telling people, like, we have to be more preventative about our health, because if we're just waiting for that blood sugar to be at over 100 on a regular basis, like now everything there's so much that has gone wrong. So another piece to this, people might be familiar with A1C. If again, you are in that state of type 2 diabetes, it's a decent marker, but again, it is not perfect because it's the average. And a lot of people who have blood sugar mismanagement, if they have low blood sugar and high blood sugar, and you're just looking at the average, well, it might look good because they're all over the place. So we want to start looking at insulin levels for people that we know are maybe at risk for entering into that metabolic dysfunction. Like I said, our system is designed, it's just too late. It's like anything, it's like doing a colonoscopy, like they only detect cancer. I mean, there's so much we can do before things happen. And I just wanted everybody to know, and then I'll be done with type 2 diabetes, because I know there's so many people that don't have it, but type 2 diabetes is a lifestyle condition. The majority of the time, it's totally reversible. Okay, so talking about Wegovy. So Wegovy came on the market, I think it was probably 6 months ago, maybe sooner, but they've been doing all these trials. So there are studies that have been done on its safety and efficacy. There were 4 68-week trials that were completed. These were well done, randomized, double-blind, placebo-controlled. So in our world like that, those are well done studies. So one of the studies was what was referred to as like a withdrawal trial. So basically what they did was they put people on this injection for a period of time. And then they followed like all the other guidelines, they were following the diet, the exercise guidelines, and they pulled the injectable from a population of the group, and they wanted to see if, what their weight would do if they did not have the injectable, even though both groups were, stabilized on the injectable for a period of time and losing weight, but they wanted to see what would happen long term. So I'll talk a little bit more about that. So in these studies, there were, more than 2,600 patients that actually received the injectable. Like I said, it was a 68-week study, and 1,500 of them did receive the placebo. So when you get the placebo, I mean, that's very important because you're comparing the medication to obviously something that has, nothing in it. And I will tell you, I mean, there are so many studies out there that show, just by telling someone that they have it, the brain can be like unbelievable. But this showed that the injectable actually did play a huge role, which I would talk about. So in their largest study, the group that was given the actual Wegovy lost 12, it was actually like 12 to 14% of their total weight in a 68-week trial compared to the placebo, which is 2 to 4%. These patients were all, so it wasn't super restricted. It was just looking at what their calorie needs were, and creating a 500 calorie deficit with some exercise. And at this point, we don't have any long-term studies on this particular medication, but medication kind of like evolves over time. So there's similar medications like this out on the market that have been on the market for a long time and have shown safety and efficacy. Contraindications for this injectable is a hypersensitivity to any glucagon-like peptide, which I know most people wouldn't know, but if you were on something similar, you would know that if you had a reaction. But really the big one is some type of thyroid cancer or a thyroid tumor, a history of cancer. Anything related to that is really a significant contraindication. And if you have any other type of cancer, this is an area where we're really digging deeper into, what kind, and making sure that whoever goes on this, it's safe for them. Some other warnings and just precautions, I guess you could say. So anyone who has pancreatitis, anyone who has diabetic retinopathy, anyone who has any issues with their kidneys, they have gallbladder disease. And I added, just this precaution because anyone that decides to do this with us, obviously we're going to be educating you on so many different things. But what I have seen and heard is that this is going to significantly suppress your appetite. So oftentimes people just take advantage of not being hungry, so they don't eat. And when you don't eat for a period of time, that really can rebound and cause more harm or more damage. So we want people to understand that it's so important to make sure that you're eating during this. This is not like our other programs where we're like, okay, super restricted. That's for a whole different reason. This program is very different. And I'm actually super excited about offering something like this because it gives those who are kind of so, they're kind of, they want to break from following something very structured, basically. Most common side effects are GI, nausea, diarrhea, vomiting. Some people had dizziness, fatigue. People who went on this with type 2 diabetes, they had side effects were gassiness, gastroenteritis, reflux. And I just noted down here like the percentage of the side effects, but really the GI side effects were really the most common. Okay, so this is a medication, it's FDA approved. So obviously some insurance companies are going to be covering it. And so with what I understand, the estimated cost out there, so like if you go to a doctor and try to get this medication, if your insurance doesn't cover it, it's going to cost people $1,300 to $2,000 per month. This is what we're hearing. We actually have a patient that did quote us that when she went and asked her doctor about it. So like I said, some insurance companies are covering it if you meet the qualifications, type 2 diabetic, BMI, the BMI qualifications. And what I wanted to talk about for us, we don't contract with any insurance companies, but that doesn't mean that you can't get covered by your insurance, because we just provide you with what's called a super bill. So if someone comes to us and wants to use their insurance, we say, go ahead and call your insurance, see if they cover it. And then, so what would basically happen is the insurance company would reimburse you directly, and you pay us and then you get reimbursed. Essentially, that's how it works. But we don't really work with insurance companies. We do everything obviously on a kind of a self-pay, and we're able to manage costs. So our costs are much lower. And how we set up this particular program is you basically pay every month, which obviously I don't put the pricing in here because the pricing, if this webinar is going out in a month or so, things change. So just understand that the pricing that we put together is much lower than what you're seeing. So, okay, so who's a candidate? Again, anyone who has type 2 diabetes, pre-diabetic, insulin resistance, a BMI of over 30, or a BMI of 27 with comorbidities. I am getting this a lot. So many people are asking and emailing, is this going to work for me? And so I am actually very, very surprised with what I'm hearing. One of my practitioners is part of a Facebook group with people that have all tried this, and people are just losing weight. So I don't, is this the next best thing? It could be, I don't know. But this is a treatment that, is not treating the root of obesity or type 2 diabetes. I mean, that's kind of what Weight Loss MD is all about. We're about, okay, let's get to the more foundational issues. So just kind of understand that it's a weight loss medication. It's going to help people lose weight. There's no doubt about that. But again, there might be some other things that are holding you back as you kind of go through it. They do have an indication for long-term use. It may be required for some people. We're seeing that people will just be on it for as long as they need to in order to achieve their weight loss goal. But then, there's no real studies that look at, okay, once you get to your goal, if you're not on it, that's why they did that one study. They pulled people off of the injection, and then the people that were not on the injection did start to gain a little bit. So that's why the indication for long-term use actually might be required. Obesity, just in nature, is multifactorial. Just remember there's other things: the gut, hormones, food sensitivities, toxicities, inflammation. I'm talking about this all the time. So while this may be the next best thing, just always kind of think back to, more of those foundational issues. What type of diet is required? So I did a lot of just reflecting on this, because for people that have been through our program, our programs are super effective. We do things very strategically to use the abnormal fat stores, because many diets alone cannot access that fat, but it requires commitment. So what we know with this is that it does not need to be as restrictive. So the studies that were done, they did kind of lower the calories and get people to eat healthier, but it absolutely does not require the extreme low calorie diets. And some actually lose weight even when the diet has not changed. So not that I'm encouraging anyone to continue bad habits and try this, but we are seeing that some people are losing even when, they're kind of, but again, there's so much to that, because we don't know what their diet was, but they literally just said we didn't change our diet. And So with our program, we're going to be providing two different plans. One is going to be more of just guidelines, and one is going to be something more laid out, because there are some people that just need a little help with how to eat, throughout the day. Okay, and then I'm going to talk about the trial that we're doing, and literally that is it. And then I'm going to open it up for questions. But whenever we start a new program or service or, medication, I always like to do a study, because, we really don't have experience. We know this has been, people are having a lot of success, but we want to really start to gain that understanding of what the realities are as people go through this. So we're going to just do a 1-month study. We're taking a limited number of people because we want to be able to obviously manage that. And one group is going to be on more of like a structured plan. It's going to be, meaning it's going to be laid out for you, versus another group is going to have just guidelines like, no Diet Coke, no fast food, that type of thing. So just getting you to make healthier choices. And then we also want to find those who are just like regular exercisers and see if we can put them in that group, rather than saying to people, okay, now you got to exercise 3 times a week for, this amount of time. So we're going to group people. We are going to require that you come in weekly, and you're going to have to, because you have to get your weekly injection. The diets, the plan, I should say, the program starts May 9th, but those who sign up will have, we'll do your assessments like the week or 2 weeks starting next week beforehand. And we're really going to just be assessing what you're eating, your symptoms, because we want to hone in on, if there's, because there are, like I said, there's digestive symptoms, your weight, your body composition. So are you losing muscle? Because again, all of our other programs really do a great job with just going after the fat. So we're going to look at, are you losing the fat? Are you maintaining the muscle? And then how much exercise you're doing. And then I wanted to just mention that this is a medication that has to be titrated. And so there is a very specific protocol that was developed, by the company and by the researchers. So the tricky part will be that, the titration can last up to 3 months. So it's going to be about finding that right dose for you. So that's where, we're going to talk to you more about what it's going to look like if you do decide to go with the study, and then you want to continue because of, you want to continue to lose, or you are not, not at your goal weight. So keep that in mind. And basically, in summary, this is a once-a-week injection. So you can either do it yourself, or for the study, we're having people come in. It's approved for weight loss and type 2 diabetes. It may be covered by insurance. It is indicated for long-term use. That doesn't mean that we're telling everyone they need to be on it forever. It's literally, everyone's going to be very different. And a big push is going to be making sure that people don't starve themselves, because normal biology, physiology will always win. If you're not eating enough, nothing you inject in yourself is going to prevent the need for the body to have nourishment. So with that, I will end it. And then I'm actually going to stop the recording and then restart it for just questions.